Chances are, if you have gone to therapy in the past, you have done an intake form. Well, what is an intake form? Intake form is a set of questionnaires that each therapist create for themselves that then they send to their clients before they come to their first session. Now, what is the point of that intake form? Why do we send it to our clients if we're gonna sit inside of a therapy session and ask them the same questions? For me, the answer relies between our conscious and our subconscious thinking. The goal of intake form is for me to do a couple of things. First and foremost, it allows me to prepare my session for you before you even enter to the session. So before you even come, I go through all of your intake form. I see what you wrote, what is it that you're seeking help with, what kind of tools do I need to bring into our session, what do I need to prepare myself for, and what is it that I need to be able to address your concerns. That's the first thing. The second thing that it will do for me, an intake form allows me to understand what is your thinking looks like when you write and you have time to reflect versus when I ask you certain questions during our intake session, which is our first session. Now, this differences between what we write and what we say truly makes a difference in terms of what is it that we're seeking help with, and it allows me to see beyond just the words that you are telling me. It allows me to kind of reflect on your thinking pattern when you sit down and answer those questions, and when you come to therapy session and answer my questions. Therefore, I can better create a session that fits you and your need. That's the whole goal. The goal for me is to create a session where you feel comfortable. And sometimes the way that we think, it's different when we speak and when we write. Finally, the third goal of an intake form, it's for me to have a reference to go back to. Now, as time goes, as we have therapy, we cover a lot of things during our session. And sometimes that period of time is a long, extended period of time. Maybe we see each other for 6-7 months and we address only one thing. Now 6 months has passed and now we're going to address something else. And having that intake form allows me to reflect back on what was it that was your main concern and how was it that those things have impacted you. And that allows me to support you better. Also, on the same note, maybe you're coming to therapy once a month or as needed. So having that intake form allows me to not only keep myself up to date, but allows me to provide you the support that you need. So the next time you want to go to therapy and they shoot you an email with an intake question, take some time on it, because that's the whole thing. If you want therapy to be valuable and to have results for you, it's important for you to treat therapy the right way. It's important for you to treat therapy with a care and compassion and time that it needs so it can work for you. And the first step of that, between this therapeutical alliance that we're gonna have between your clinicians and you, is that intake form. The more comprehensive it is, the better your clinician will understand you. Now, by no means I'm saying that you should sit down and write an essay for your therapist, because that also makes us tedious for us to go through all of those things. And sometimes we're not gonna be able to go through pages and pages of information, but make sure to include the most important relevant information that stands out to you inside of your intake form. As always, thank you for watching. My name is Ehsan Shabahang, licensed mental health therapist, and I look forward to seeing you in our next video.